Hello, my name is Elizabeth Domino. I'm here to talk with you today about a very important bone disorder, osteoporosis. What is osteoporosis? Osteoporosis is the most common bone disease and is characterized by compromised, that is decreased, bone strength, becoming predisposed to an increased risk of fracture. Changes appear in the fine structure or microarchitecture of the bone through the coordinated functions of specialized bone cells. The cells involved are called osteoclasts, known for breaking down and reabsorbing old bone, and osteoblasts, responsible for the formation of new bone. As people age, they often lose bone more quickly than they can replace it, thus leading to more porous and brittle bone. If left unchecked, this loss can lead to a disorder called osteopenia, which can develop into osteoporosis. Bones become weak and prone to fracture, even with the mildest impact, such as tripping and falling on a loose rug inside your home. The most common fractures in osteopenia and osteoporosis occur in the hip, spine, and wrist. With the spine and hip, if fractured, the individual is susceptible to chronic pain, deformity, depression, disability, and even death. Half of the people who break a hip never regain the ability to walk without assistance, and a quarter of them end up needing long-term care. Osteoporosis does not cause any symptoms, and because of this, people do not know they have it until they unexpectedly fracture a bone or are diagnosed by a bone density scan. Why is diagnosis and treatment important? For someone with osteopenia or osteoporosis, a low-impact bone fracture can beget another and another. Generally speaking, postmenopausal women over the age of 50 with a family history of osteoporosis and individuals with petite or low body weight and personal or parental history of bone fracture or height loss are at risk for developing osteoporosis. Long-term use of steroid medications like prednisone from those diagnosed with rheumatoid arthritis and other secondary disorders linked to osteoporosis, such as type 1 diabetes, are strongly associated with osteoporosis and are at heightened risk of developing it. There are controllable risk factors leading to the development of this disease, which can include individuals not getting enough dietary or supplemental calcium and vitamin D, those with a poor intake of fruits and vegetables, or consuming too much protein, sodium, and caffeine. Additionally, individuals who smoke, drink alcohol in excess of 3 drinks per day, and maintain inactive lifestyles are at risk. The bone density test sort of measures how strong your bones are. This is the exam to both screen for and diagnose osteopenia or osteoporosis. The DEXA, which stands for Dual Energy X-ray Absorbometry, can alert you to problems with your bones before you have a fracture. The hips and spine are scanned because they are best at predicting who will have an osteoporotic fracture. The DEXA is also best at monitoring an individual's response to treatment. On occasion, the forearm may be scanned when the hip and spine cannot be measured. The Z-score represents numbers that compare your bones with others your age. The T-score compares the condition of your bones with those of an average young person with healthy bones, like those of a 30-year-old. The lower the bone density score, the greater the risk you have of fracture. The normal bone density score falls within 1 standard deviation of the young adult reference population. This is a T-score of minus 0.9 and above. Osteopenia is demonstrated when the score falls more than 1 standard deviation but less than 2.5 standard deviations below the young adult reference population. That would be a T-score of minus 1.0 to minus 2.4. Osteoporosis is diagnosed when the T-score falls below 2.5 standard deviations or minus 2.4 and below. As a general rule, for every standard deviation below normal, the fracture risk more than doubles. Therefore, a patient with a T-score of -1 has at least 2 times the risk of fracture as a person with a normal bone density. If the T-score is -2.0, the risk of fracture is more than 4 times normal. A T-score of -3 is greater than 8 to 10 times the normal fracture risk. We begin with the role of calcium and vitamin D3 supplements in foods. The calcium in our body is necessary for life. It is as essential for building bones as it is for clotting blood and sending messages between our nerves and muscles for contraction and movement. We lose it through our skin, nails, hair, sweat, urine, and feces, and because we don't produce it, we must get it through our daily diets. When we don't take in enough calcium through our food, supplements may become essential, or it will be taken from our bones. Vitamin D promotes the absorption of the calcium in our gut and maintains adequate serum, calcium, and phosphate concentrations in our blood to enable normal mineralization of bone. It is also needed for bone growth and bone remodeling by the osteoblasts and osteoclasts. Vitamin D is responsible for other important functions in our body as well, to include cell growth, neuromuscular and immune function, and it helps in the reduction of inflammation. Unless you are instructed not to take either of these supplements or you are being treated by another provider, the recommended dosing for calcium and vitamin D3 is 1 600 milligram tablet 2 times a day. Be sure to include a multivitamin with minerals. In addition, add a separate vitamin D3 tablet, 1,000 international units, daily. Taken this way, you'll receive 1,200 milligrams of calcium and 2,000 international units of vitamin D3 over the course of a day. This dosing is essential, especially if being treated with Prolia or denosumab injections. Regarding pharmaceutical treatments, we begin with bisphosphonate medications like Fosamax, Actonel, and Boniva, which are used to target the osteoclasts, which remodel the old bone. Evidence shows they decrease the risk of fracture in those who have had previous fractures. They inhibit the digestion of bone by encouraging the osteoclast to undergo cell death, which slows the bone loss process. They appear to have a beneficial effect on osteoblasts, the bone-forming cells. Denosumab, or Prolia, is a prescriptive medicine given by injection once every 6 months into the fat of the upper arm. It is used to treat those who have failed bisphosphonate therapy and those with other risk factors such as bone fracture history. The mechanism of action fools your body into believing it has enough bone resorptive cells, the osteoclasts, thereby not producing them and allowing the osteoblasts to continue their bone-making function. Weight-bearing exercise is an essential treatment recommendation as well. A properly designed exercise program helps prevent falls and fall-related fractures by strengthening your bones and muscles. Exercise also improves balance, coordination, and flexibility. Combined, these results help to prevent falls and fall-related bone fractures, which is especially important for older adults and those diagnosed with osteopenia or osteoporosis. The best exercises for building and maintaining your bone density are weight-bearing activities such as walking, tennis, and the like. Any movement that makes you work against gravity while staying upright is best. Muscle strengthening exercises conducted in a standing, sitting, or prone position, such as weightlifting, are also beneficial. They make you work against gravity, which builds and strengthens muscles and bone. Activities related to balance, functional, and postural movements, like Tai Chi, may benefit some with osteoporosis, but overall they are deemed helpful for general health benefits in older people. The takeaway message with osteoporosis is to learn all you can about this disease process. Please go to your local library or visit online resources like NOF.org, which is the National Osteoporosis Foundation, to get the facts. Learn about prevention and healthy living. Exercise. Remember, bone fractures can be prevented. It takes you and a commitment to your health to get the ball rolling.